One.
Good evening and welcome to this live question and answer event with Tower Hamlets Council. Thank you for joining us. I'm Councillor Danny Hassel and I'm the Cabinet Member for Children and Schools here in Tower Hamlets, and I'll be chairing this evening's event. I'm joined this evening by James Thomas, our Corporate Director for Children and Culture, and by Katie Cole, Dr. Katie Cole, our Associate Director for Public Health. This evening's event will be in two parts. The first part will be a presentation from Katie, who will take us through some of the key public health messages and talk to us about some of the key issues we're seeing in the borough. And then the second part will be in the form of a question and answer, where we'll be answering your questions on issues related to COVID, children, families and schools. So over to Katie for her presentation.
Hello, I am Katie Cole. I'm Associate Director of Public Health for Children and Families in the Borough. And we are doing this presentation because we've been hearing from families that they'd love to hear more about how COVID is affecting children and families in the borough and how we can work together to stay safe. So I'll be going through three main things. Firstly, I'll be talking about the local picture. Then also about a little bit about COVID itself and about how it affects schools and some of the things we've been doing to protect children in schools. And lastly, I'll talk about how we can work together to try and protect children and families in the borough. So in terms of the local picture, this chart is showing how the number of cases in Tower Hamlets over time. And you can see on the left-hand side that there's a wave one that peaked in April earlier this year, and then a really quite low numbers of cases over the summer and in the summer holidays. And you can see again the cases rising quite sharply over the last month or so. And that picture has also been seen in England as well, and I'm sure you will have seen a lot in the news about us being at the beginning of a second wave. In terms of cases in schools, we've had 119 cases so far in Tower Hamlets schools, and we've been able to learn a bit more about those because we've set up a really good surveillance system where we can track cases in Tower Hamlets schools. About half of those cases were seen in staff and about half were seen in pupils. And in terms of the schools affected, about half of them were in primary schools and half of them were in either secondary schools or our specialist schools in the borough. We've also been able to see how the infection has spread in Tower Hamlets schools. And from that, we've seen that very few cases, fewer than about 5, have been caught in school. Right? So the infection has actually spread in schools. So very, very few. And what we have seen is that the majority of the infections seen in schools were caught from other household members at home. So and that's what we've seen through national and international research. So COVID is mostly transmitted between household members or between people visiting your home. There's very few examples, both locally and nationally, of COVID spreading in schools, particularly from children to children. But I'll talk a bit more about that later on as well. So a little bit about COVID. We know that for most people, COVID is a mild disease, meaning that they can look after themselves at home. About 15% of people need admission to hospital, and about 5% of people who've had COVID need extra therapy on an intensive care unit. And we also know that about half of those people who were admitted to intensive care sadly pass away. And that picture, however, varies really significantly by age, but also by the background health status of that person and also by ethnicity as well. In terms of children, there's an increasing understanding about how COVID affects children. So it's been quite clear from the beginning of the pandemic that children have quite a mild infection or mild disease on the whole. Deaths in children are really extremely rare. We've unfortunately had 6 deaths nationally, and no children have died in Tower Hamlets from COVID. There is emerging evidence that is showing that children appear to be less likely to catch COVID. It appears that they're about half as likely to catch COVID as adults. And there's some really interesting research that came out the other week that suggests that even living with children as an adult can reduce your risk of catching COVID. And that's something to do with children getting protection from other viruses in the coronavirus family and that protecting them. But that's all new. So that's reassuring research showing that children appear to be less likely to catch it than adults. There is some evidence to show that children may be less likely to pass it on to adults as well. So I'll talk a bit about symptoms. I'm going to come back again to protecting older people at home when children are going to school as well. So the main COVID symptoms are a high temperature, a new continuous cough, and a loss or change to a sense of taste or smell. So what does that mean? Well, with a high temperature, if you do have a thermometer and you measure it, we're looking for a temperature over 37.8, but you don't need a thermometer. You can actually assess somebody else's temperature by touching them. So if you touch the centre of their body, their chest or on their back, and they feel hot to you, they feel unusually hot, then that is definitely good enough to assess a temperature and to suggest that you need to get a COVID test. You could also have a new continuous cough, and that means coughing a lot for more than an hour or having 3 or more coughing episodes over 24 hours. And for people who have coughs regularly, it's a cough that's worse than usual. And then the last one is a change or a loss to a sense of smell or taste. I prefer, it's called anosmia is the technical word, and it's a lot easier to say. But basically it means that things don't taste or smell right to you. They don't taste or smell anything at all, or they smell a bit weird, a bit different to usual. Now, you don't have to have all of these symptoms. You can have 1, 2 or 3. So that's the main, what we call the main symptoms. But we know that children can have COVID with other symptoms. So they may be tired, they may be achy or have a headache or have diarrhea. So we know that, and that picture is much more common in children than in adults as well. But the most important point is that it's unlikely that a child will have coronavirus without any of the 3 main symptoms before. And so that is why we're asking that children get tested if they have 1 or more of those 3 main symptoms. One of the other things we say as well, I've heard, is people saying, well, you know, children could be asymptomatic, so should we test anyway? And the answer is no. The evidence of children passing on COVID if they have it, but they don't have any symptoms, is quite limited, so we wouldn't recommend testing. Now, there's quite a lot of concern at the moment that children may have colds or flu or COVID, and how are we supposed to tell the difference between those? Well, if you're not sure, the best place to go is the NHS 111 website or call up NHS 111. But basically, the main message in terms of COVID is if your child has a runny nose, for example, but they don't have any of the 3 main symptoms like fever, cough, and the change or loss of their sense of taste or smell, If they don't have any of those 3 main symptoms, then they don't need to be tested. So if they have a runny nose and nothing else, then there's no need to test. But if they have a runny nose and they have a high temperature, then you do need the test. And the test will tell you if it's COVID or not. It won't tell you whether it's flu or a cold, but for the purposes of this, that's okay. And you can find out how to look after kids with fever with any sort of everyday runny noses on the NHS website as well. So if there are no COVID symptoms, children do not need to be tested. No one in their household needs to self-isolate, and they can go to school if you think that they're well enough to do so. Okay, so talking now about how COVID is spread. So COVID is a virus, it's inside you, and it needs to get out and infect somebody else. And it doesn't leave you sort of through your skin in a bad aura or anything like that. It has to hitch a ride on something leaving your body. And it does it most effectively when you cough or talk or sing loudly and perhaps particularly badly, and release out some what we call respiratory droplets, so spray. And it hitches a ride on the spray, and it flies through the air, and it can either go straight into somebody else by them being really nearby and breathing it in, or it can land on the surfaces around that person. It doesn't go too far, a metre or two. It lands on those surfaces, and then you can pick it up on your hands, and then when somebody touches their face, it can go into the body through the mouth, the nose or the eyes, and that's how you catch COVID. So that is why we really emphasise some pretty basic, free, very unexciting, but highly effective ways to stop COVID spreading. So washing your hands regularly means that your hands are clean if you touch your face. Wearing a face covering offers some protection to other people as well. If you have got COVID or you're brewing it and you might be infectious. And keeping space and a safe distance from other people means that you stop that direct transmission from one person to another breathing it in. So how can we protect children and families together? So as I said earlier, the main way that COVID appears to be passing around both in the UK and also in Tower Hamlets is from household to household or within households. So the main way is within households, but the second most common way is between households. And so given that our rates in Tower Hamlets are rising rapidly, and we have one of the highest rates in London, we are now asking families or households to avoid visiting each other if that's possible. So if there's a support bubble arrangement in place, then that's absolutely fine, but to avoid it unless absolutely necessary. We've also been working really closely with schools, with heads, with unions and colleagues right across the council to make sure that schools are as safe as possible and that there's lots of things put in place to stop COVID passing around in schools. So the big 5 things that we've been doing are trying to make sure that everyone understands the need to stay at home if children have or staff have symptoms of COVID and to get tested. We have been supporting schools to ensure that children and staff are washing their hands more regularly, that we promote what we call respiratory hygiene, which basically means coughing and sneezing in a safe way, following the catch it, bin it, kill it advice. There's been a lot of consideration around how we can have really good quality, frequent cleaning right across the school. And that's about catching and getting rid of the virus if it is on any surfaces. And I'm sure parents will be really aware of the bubble system and lots of ways that schools are trying to reduce contact and mixing and just to slow down the spread of COVID in schools, and particularly also outside schools and between staff as well. One of the most important things that we need to do, as I said earlier, is if you have symptoms of COVID, to get tested. But I'm now aware that there's quite a lot of concern and confusion about who should get tested and when. So this is I think it's quite a handy chart that shows how who should do what and when. So if you're a confirmed case, that means you've had a test and it's come back positive, or you're a suspected case, that means somebody who's got symptoms, those 3 main symptoms, then you need to isolate and you need to get a test if you haven't already had one. Contacts of cases, so that's a confirmed case, that's they need to isolate, but contacts do not need to get tested unless they develop symptoms. That is because if you don't have symptoms, you may be brewing the infection, but the amount of virus in your blood might be too low to be picked up on the test. So if the test comes back and it says, no, you don't have COVID, you could be really reassured when in fact a day or 2 later you could test positive because the virus has increased in your blood. So we say only get a test if you have symptoms, or in a small number of cases where a doctor has told you you need to get a test. And contacts also, and then the third group of people are contacts of contacts, so people who've been in touch with somebody who is a contact, and they don't need to do anything differently unless they get symptoms. So no need to isolate and no need to get tested. So I thought what would be handy is to tell a bit of a story about a family in Tower Hamlets who were affected by COVID. Now I've chosen some characters that are in my file at work, so these aren't a representation in any way of the family, and yeah, it's just to illustrate a story. So, but it is based on a true story. It starts off with a mum. She developed a new continuous cough, so one of the COVID symptoms. She knew what to do. So she immediately stayed at home. She started self-isolating for 10 days, and she did the right thing and told her family to isolate at home with her for 14 days. So they are potentially contacts. She ordered a home test and it came back positive for COVID. So she got involved with NHS Test and Trace and shared a list of all of her close contacts and followed the advice to say that she needed to stay at home and complete that 10-day self-isolation period. However, the next day, her daughter also developed a new cough, and it was okay. She didn't need to do anything differently insofar as she was already self-isolating, and the mum ordered a COVID test for her, and that came back positive as well. So she did the right thing as well. She carried on at home and she self-isolated for 10 days from the symptom onset, and her parents got involved with NHS Test and Trace again, and they said that she had been at school the day or 2 before she had symptoms, and so that there was a risk that potentially there were some children at school and staff at school who could have caught COVID from her. So the mum called the school that evening straight away, and the school picked up the message. So they got cleaners on site to make sure that the school enhanced cleaning went right through the school, and the senior team met up extra early in the morning as well. The head teacher called the Department for Education hotline that's been set up to help schools manage cases, and they went through a risk assessment with the head teacher, and they identified all the close contacts in the school and told the bubble that the girl was in and the teachers to self-isolate. They advised on enhanced cleaning, but the teacher was really pleased to say that she'd already done it. and some template letters were provided to the school as well. So I think that case is there just to show you how the system works, and that there's lots of processes in place to make sure that schools rapidly identify children and staff who may have been in contact with the case, and that the sort of support there is there to make sure that we don't get onward transmission in schools, or where it happens, it stops in its tracks after that point, and we don't get large outbreaks. Now, I'm really conscious that there are a large number of families in the borough who may be concerned about sending their children to school where there are elderly relatives at home, or relatives who have medical conditions that might put them at risk of a severe infection. And one of the things that you can do if you have a child who is at home because they're a contact of somebody with COVID, and you're worried your child might have picked up COVID as a contact, is to follow some of the advice on the slide. And this is about trying to prevent a case passing on COVID within the family. So it's kind of, some of it's common sense advice, but common sense advice is common because it's been around for a long time and is shown to actually reduce COVID passing from person to person, or infections passing from person to person. So it includes, if possible, making sure that that vulnerable person stays in a different room to the child, trying to avoid using shared spaces as much as possible. So maybe only one person using the kitchen. If there's separate bathrooms, trying to allocate separate bathrooms. Washing hands, again, covering your nose, washing your hands after you cough or sneeze. Trying to keep windows open if possible. I recognise we're going into the winter. Where it's a member, where it's an adult, they may want to consider wearing a face covering as well, and also doing lots of frequent cleaning. We're also conscious that self-isolating can be really hard on families in other ways, including in logistically and financially. So there's quite a bit of support available. There's some advice from the central government. We also have an NHS volunteer responder service as well. And in terms of Tower Hamlets offer, we can provide advice to residents on financial issues and food and medication deliveries. And there's a hotline there, our 3030 number, but you can also make a referral online and go use our Tower Hamlets website to find out more about that. Also a reminder, if you haven't picked up on the media, to download the NHS phone app. So that can be a really handy way of making sure that people, if you do test positive for COVID, that people are alerted, perhaps people you're not aware of. It also gives you some information about the levels of coronavirus in your postcode. It can help you avoid filling in forms when you go out and visit different areas because it's got the QR code scanner, and it gives you advice on symptoms and how to order a test as well. So lastly, just to promote our COVID Community Champion scheme. So I'm conscious we're joined by some COVID community champions tonight, but just to promote it to those people who aren't already COVID community champions. This is something that we're trying to develop a really good, strong network of local residents who become a kind of trusted source on COVID. So they're provided with the latest information and advice, and can share that amongst their own networks, you know, your own WhatsApp groups, or your friends and family. So to do that, the ask is that you can come along to regular webinars to find out more and to get up to speed. We also will share out key messages with you, and it gives you a chance to ask questions as well and provide feedback. So it's a way that we can we can talk and we can shape the council's response as well. So if you're interested, you can sign up on our website, and I think the link, David is posting the link in the web chat as well. So please do consider signing up. So thank you. I'll hand back to you, Danny.
Thank you, Katie. We will now move to the question and answer section of this evening's event. So please do submit your questions on the right hand side of your screen. There should be a chat function. You can submit them and then they'll get published, and we will try and get through as many of those as we can in the next hour. We know that some parents might have specific questions about some of the decisions specific schools have made, and whilst we'll try and talk about some of the context to that decision making, for obvious reasons we can't talk about individual school decisions in particular, and so we do ask, if you have specific concerns, that you speak to your school about them. Okay, let's go over to the first question of this evening. I think it's already been covered in the presentation, but worth just reiterating, I think, for Katie, and it's from Habib. If a parent tests positive, but the child has no symptoms, 1, should the child get tested, and 2, should the child go to school?
So if the parent tests positive, they're a case and the child is a contact. So the child needs to stay at home for up to 14 days. And that's because they may have caught coronavirus from the parent, and it can take up to 14 days to show symptoms. So they need to complete a 14 days staying at home, and they should not be going to school. They should only get tested if they have symptoms, and that is because if you do it on day 1, they may test negative, but they may not get symptoms until day 13, and at that point test positive. So the test won't tell you whether they've caught they've caught it and there's a tiny amount of COVID in their body. It'll only tell you if they've got really quite a higher amount. And you can only, it's most effective when people have symptoms, and that's why we say only get tested when you have symptoms.
Thank you, Katie. The next question I think is for James, and that's, what's the likelihood of an extended half term in Tower Hamlets? False rumours or a likely situation?
Thank you, Danny. Yes, I've been asked this question by lots of people, both parents and professionals. As it stands, there are no plans for an extended half term. It will be the same half term as usual. A lot of rumours have been flying around about this, not just in Tower Hamlets, but across the country. And my team speaks to officials at the Department for Education every day, actually, at the moment. And so when we started hearing this rumour, we asked the civil servants at the department if there were any such plans. And they've always been really clear. Now, the expectation on all schools across the country is that this will be a full term to the usual term dates. So no plans for an extended half term this year.
Thank you, James. The next one I think is possibly for Katie, but James, you might want to add to this as well. Is it necessary for a whole year group to be sent home if there's one case in the year group? Can we reduce bubble sizes to reduce the number of times children might have to be sent home to isolate?
Great question, and a very hot topic at the moment, actually. So it depends is the answer. If it is a very small bubble, or the year group is small, so it's say a preschool or a reception class with one reception class per year, then the general advice is that whole group would need to go home and self-isolate. In larger year groups, so in secondary schools, it's a bit more nuanced. So the approach is that the head teacher will speak with the Department for Education's hotline, and they will look at that particular case and who they came into contact with, the amount of mixing that they had, and then they will decide on how many people were actually in close contact, and will isolate on the back of that assessment. There have been instances where whole year groups have gone home, so a large number of pupils, and we have explored those quite carefully. In some instances, it's actually because of staffing concerns or staffing issues, and some of it is about how the school had set up the classes, so there was more mixing in that case. I think the approach that we are moving towards this term, based on the experience we've had in recent weeks, is to try to work with schools to minimise the risk of whole year groups isolating, because obviously we really need children to be in school and to learn and to benefit from really fantastic educations.
Thank you. James, is there anything you want to add to that one?
Well, just briefly, that we know that schools are thinking very carefully about these decisions, and trying to ensure that they act on the advice from public health colleagues, and ensure that all of the right safety measures are taken, but that children are not sent home unnecessarily to self-isolate. The head teachers that I've been speaking to, and I've visited 5 schools in the last week, are all saying that they're feeling more confident now in making these decisions, now that we're 5-6 weeks into the new term. But they still they think very long and hard about these decisions to make sure they try and always get them right.
Thank you. The next question then for James, one we've received in advance. Can schools change the start and finish times without consulting parents?
So the simple answer is yes, they can. But they can change the start and finishing times without a formal consultation. And it's another example of the kind of extraordinary challenges that schools are having to respond to. So every school has been required to carry out a risk assessment to ensure that their school is a safe environment. And as one of Katie's slides was showing earlier, one of the very common steps that schools have taken is to stagger both start and finish times, essentially to avoid crowds gathering. And we know that some schools struggled a bit in the first 2 or 3 weeks of term, where they didn't get that quite right first time and have had to make some adjustments. So schools are following the very detailed statutory guidance that government has issued, and it's in following those risk assessments to ensure that they're providing a safe space in school, that yes, they can adjust those start and finish times without a formal consultation. Now that doesn't mean that every school shouldn't be communicating really well with all parents. They absolutely should. And I know that schools are feeling very stretched, but they're very conscious of the need to communicate consistently, clearly and frequently. And I also know that I've heard from some parents that they have particular challenges where a school might have adjusted a start time, but of course some parents will have different siblings in different schools and will have a complicated kind of juggle of getting each child to the right place at the right time. Please talk to your school about that if that's the case. I would hope and expect that the school would be flexible and recognise that where that is the case, they may need to kind of make an adjustment for your child.
Thank you, James. One for Katie, I think. With the rate of infection now very high amongst the 10 to 19 age group, do we need to take more measures to reduce crowding in secondary schools and support adults who are clinically extremely vulnerable or clinically vulnerable?
Well, I think we need to. I'm not sure it's right to say that the rate of infection is very high amongst the 10 to 19 group to start with, because from the data we have on Tower Hamlets schools, we've seen that the numbers of cases are equal between primary and secondary schools. So it doesn't appear that the rate is higher. And when you look at national data that breaks down cases by age, we see that rates in both primary and secondary school children are significantly lower than in adults, and the risk starts rising from about 18. So I don't think that first part is perhaps as strong as it could be, but in terms of measures to reduce crowding in secondary schools, I think I would also go back to the first point I made in the presentation about how there isn't strong evidence to show that COVID transmits particularly easily in schools, though I recognise that towards the end of the teenage period, so in sort of 16, 17 plus, you start to see a more adult pattern of transmission, which is why that sort of the face coverings advice is in secondary schools versus in primary schools. I think that schools have already done quite a lot to reduce crowding as we've kind of gone through. So that's the one-way systems, the bubbles, the sort of range of different things, though recognise that that we need, because we need to have children in school and in learning, we haven't gone down the route of trying to do sort of part-time learning to do that, to kind of reduce crowding further. So I think my point is, at the moment we're not considering doing anything further, partly because of the risk of infection spreading in secondary schools is perhaps not as high as it's perceived to be, but also we're doing quite a bit already to reduce risks in schools. Yeah, thanks, Danny.
Thank you. Is there anything you want to say about the clinically vulnerable groups as well, and support for those adults?
Yeah, yes, thanks. So nationally, the decision to put back into the shielding advice is taken by central government, and we're not seeing shielding being put back in place in some of the lockdown areas in the north with much higher rates of infection compared to down in Tower Hamlets. I think the evidence that we have so far is that children are less likely to pick up COVID in schools than they are at home or from visitors in the home. So for clinically extremely vulnerable people who are really concerned about protecting themselves, I think the main messages would be about making sure that you minimise people visiting your household, that you really stick to the government advice on hands spaced and space. And if you are particularly worried about your child being a contact of a confirmed case, then you can take the steps that I put in one of the slides about how you can reduce the risk of transmission at home as well.
Thank you, Katie. Next question for James is a question we've received in advance, which is, how can you help children who have fallen behind at school with their learning?
So it's a really good question, and one that I think a lot of us have been asking and worried about. I think there's probably three kind of main ways in which children who've fallen behind can be helped. And the first is the most obvious one about children being back at school and learning. I mean, it's one of the reasons why we all have made such an effort to ensure that all children could return in September and stay in school. The second point is that all schools that I've spoken to, all the schools I've visited and the head teachers I've spoken with are very focused on this and are thinking about how to deliver the curriculum to all of their children in a way that enables them to catch up. So in a way that's sympathetic to the fact that many children were not receiving kind of routine schooling for a period of 6 months. And then the third approach, which schools are used to doing, is about individualised learning and schools knowing the needs of each and every single child in their schools and being able to, for teachers supported by teaching assistants, being able to deliver learning that's individualised for those who do need extra assistance going forwards. Again, it's just a little snapshot, but the schools I've visited in the last week or so, head teachers were expressing confidence that they and their teams know how to do this. This is their kind of core bread and butter, and we're feeling reasonably confident that they'll enable children to catch up. But it's something they're all very focused on, I know.
Thank you, James. Another question then on school holidays, which is about some schools in Waltham Forest, another borough in London, have extended their December term holiday to 3 weeks and reduced their summer holiday next summer by 1 week. Would Tower Hamlets consider such a move when it's happening in neighbouring boroughs?
So I think I'd probably say two things here. I mean, the first is if there's one thing that we've learned in delivering services and schools and all of our public services through the pandemic, is the need not to make too many assumptions about what we'll be doing in 3 months' time or 6 months' time. We've had to constantly adapt and be flexible. So I'd certainly kind of remain open-minded in that sense, because we're entering clearly a second wave of the pandemic, and we don't really know what lies ahead. Having said that, at the moment, I talk with our school leaders all the time, as does my team, and there isn't a view that is pressing in the borough for reducing term times, really because of the last question that we took. Because I think everybody thinks it's so important that children are now in school fully. There is a lot of catching up to do, and so I think the commitment is there to try and ensure that we run to the full term timetables.
Thank you. Next question then for Katie, which is around, can you give a little bit more detail about some of the surveillance systems in place and how they help schools identify children testing positive?
Yeah, so the system we've got up in Tower Hamlets is that all schools notify my team, the public health children's team, when they have a case in schools, and we track that. So we're aware of what's going on. We know how many bubbles are self-isolating anytime, and it allows us to look for secondary cases as well, and that means any children or adults who have caught COVID in that school from the first case. So it appears to be working really well. It's given us a really rich and timely source of information about what's going on in the borough. Now the second part of the question says how the system helps schools identify children testing positive. So it doesn't focus on that. The way that schools actually identify children testing positive is through a few different routes. So the way that actually it works in practice is that parents tell the school, and we haven't had any concerns about parents not sharing that information with schools actually, even though there was some concern that might happen previously. But in any case, there are national kind of data flow systems where if a person tests positive, the lab will notify various organisations, and that information flows to my team and to Public Health England, to NHS Test and Trace, obviously. So if we are aware, if we, for example, in my team, if we're notified of a case in a particular school from Public Health England, if it's not in the case tracker, then we can always contact the school and let them know. But in practice, that hasn't happened, and it appears that that information is flowing well locally in Tower Hamlets.
Thank you, Katie. Next one then for James, which is a question we've had in advance. Since cases are rising, should parents be given an option to either send their children back to school or to choose home or remote learning?
So I don't think it's really possible for parents to be given this as an option. Cases amongst school-age children still remain very, very low in number, and we have between 85 and 90% of our children in all primaries and all secondaries are in school and learning. And so our schools really have to focus on having resumed delivering the full curriculum to almost all of the children that are in school. Now, schools did have to develop a remote learning offer before the summer break, and where children are self-isolating, or where whole class bubbles, or in some cases whole year groups are self-isolating, then schools are attempting to again provide a remote learning offer, but they're having to do that at the same time as delivering the full school day to 85 or 90% of the children. And schools are clear that the remote learning offer is not as good as the full curriculum offered in school. And I've spoken to head teachers in schools about this. They're clear they cannot give this as an option to parents, no.
Thank you, James. Next one I think is for Katie, which is a question from Rich Mix, one of our great art centres in the borough. What are the guidelines around students or young people visiting COVID secure art centres? Because they're planning some activities and they wanted to know about the mixture of online and offline.
So I think it would depend on the details, actually. So I don't think I can just say now whether that's fine or not. I think the principles are that if it's already deemed to be COVID secure and there's a risk assessment in place, and the youth service itself has done its risk assessment and it's they're happy with the approach too, then that should it feels that should be okay. But equally, I feel that there's it's a bit of a case by case matter. So one of the things that we are supporting Tower Hamlets Youth Service with is as with all of the services in children and culture, is how to operate safely during the pandemic. So we'll be really happy to kind of explore if there are any particular issues with that proposal and support you.
Thank you, James.
Well, I suppose that just to add to what Katie's said, that we know we've surveyed young people directly who've been really clear with us about how they feel the need to resume face-to-face youth service activities, and that the kind of virtual offer that they've been offered previously kind of wasn't enough. And so we do, I mean, with all of the kind of risk assessments in place and making a COVID safe offer, I do think it's really important that young people are able to resume activities in a safe and managed way, and we do have to be kind of mindful about their well-being and mental health, as well as managing the kind of risks from COVID.
Thank you. Next question then is from Edwin, which is around, do we have a comprehensive IT support resource in place to ensure that children, families and young people without IT equipment at home are not further disadvantaged? James.
So So I do worry about this one, because I think we know that in Tower Hamlets, not all families have the IT kit or the Wi-Fi to enable effective home learning. They're clearly, we've all as a system kind of made a great effort to try and address that, but I know that that hasn't always been successful. There is a kind of a matrix, if you like, of support to try and enable that to be the case, and that's the starting point is with the school, and schools have. There are very, very many examples of where schools have been able to move quickly to distribute kind of laptops and tablets to families, to try and support families if they didn't have Wi-Fi already. But they haven't always had enough resource for that. The government has had a scheme rolling out laptops to be distributed initially for vulnerable children, and another phase of that is due shortly, which will go just directly to schools to distribute. So there is a matrix. People are quite focused on it, but today I know there are examples where it hasn't always been comprehensive, and I know there are examples of schools that in trying to plug some of those gaps have been fundraising. They're good examples of people fundraising and donations being made. So there's a kind of a third tier. So the school's own resource, government distributing what it can, and then there's been some local fundraising to try and complement that. But it's something that we're still all working very hard on.
Thank you, James. The next question is around early years. So how can we expect children in the early years to maintain social distancing? Katie, do you want to take this one?
Yes, as a mother of an early years child, I can comprehensively say that you can't expect a child in early years to maintain social distancing. That's not how they behave, and it's also not appropriate for staff to maintain distance from children that little as well, because they need hugs and support and all sorts of things. So the government guidance has always been really clear that in early years social distancing isn't expected, and other infection control mass interventions are enough to prevent transmission. And then I also go back to some of the bits in the presentation that show that children who are little are less likely to pass on COVID between them, between each other as well. Yeah, thanks.
Thank you, Katie. Next question for James is around large primary schools, and again that phased school day and parents feeling concerned about making multiple school trips.
Yes, so I think I said something about this in response to one of the earlier questions, and I'm very sympathetic to the kind of challenges here. And as a father of three myself, I know what that juggling is like, although mine are a lot older now. So I think again, as I said previously, it's not that schools are able or it's feasible for them to carry out formal consultations about the arrangements that they make, but I do expect schools to communicate clearly and then have a listening ear for those parents for whom this is difficult. And I don't think there'll be any schools who haven't made adjustments and amendments to the plans that they put in place at the start of term. I think some schools will probably find it easier to be flexible than others, and I'm very sympathetic to the kind of additional anxieties that some parents will have, where they are required to make multiple school trips. I'd encourage you to kind of share your anxieties with your school, and ask if there are ways in which they can help. But of course, it's difficult for schools because they have to kind of manage in a way that works for all children.
Thank you. The next question then is, although the national figure does suggest the transmission from pupils to pupils is not high, how can communities stop the transmission to students whilst living in the same household? Katie.
Sorry, Danny, do you mind repeating that again?
That's fine. So it's the national figure suggests that transmissions from pupils to pupils is not high, but how can we all as communities help stop the transmission to students whilst living in the same household? So I think it's something about general household class.
Yes, yeah, as per the slide. So it's about trying to have really good hygiene at home. So washing your hands regularly, covering your mouth if you cough or you sneeze, or using a tissue ideally, binning it, killing it by washing your hands afterwards. And if you are symptomatic, even if if you've got a mild cough, if it's still there, it's new, it's continuous, get tested. So if you have got the symptoms of COVID, one or more of the 3 main symptoms, make sure you get tested.
Thank you, Katie. The next question then is about children with autism and how can we support them so that they feel safe to attend school, particularly where there's been a case in their school. James or Katie, I'm not sure who wants to take this one.
Shall I go first, then Katie can come on after? So I think so the first thing I guess I'd say is that, of course, children with autism, every child is different. So I think really it'll depend on what's the most effective way of communicating with each child about this. And I think it has to be just a question of sort of calm reassurance, but also a recognition that everybody's anxious at the moment, and it's not that anxieties aren't kind of well-founded. I guess the sort of concrete, I mean, given that we are not experiencing, even for those small numbers of children who test positive, that they are having any significant kind of health difficulties, those children will be back in school within 2 weeks. And so that might also be a sort of helpful thing to communicate, that can be the reasonable expectation. And that's what they'll see is that their friend or peer in school will be back soon. Katie, anything you want to add to that?
I suppose we've been working closely with our specialist school in the borough of Phoenix to just make sure that they are able to operate safely, and recognising the additional kind of needs of the school and some of the challenges particularly around social distancing in that school community. So we've made sure that we've given additional support to our specialist schools to make sure that they can still operate really safely, and to try and build confidence as well. And we've done some special seminars with parents of children who have SEND, who were concerned, particularly for those who've been shielding, about going back to school as well, which the feedback from those has been that they've been reassuring, and that parents have been much more confident to send their children to school after that. So that's just sort of one part of our broader work to kind of talk with families and hear their concerns and to share what we know as well. And that's what we're doing today as well.
Thank you, Katie. The next question then is, I assume, about the new announcements that were made yesterday by the government. What tier is Tower Hamlets in, and what are these restrictions? Will there be a level up, and if so, how will this be communicated if it's decided?
Yeah. We're in medium tier at the moment. There are some discussions about when London might move into the high tier, and that may be in the next week or so. When that decision is made, it will be communicated extremely clearly, I hope. So this will be information through the national media, but also coming from the council and from its partners as well. So one of the main things that we want to do as the council is to help residents understand and make sense of the sort of barrage of information and advice around COVID, to kind of simplify it and make sure that the most important messages get through. And I guess this is an opportunity also to plug the COVID community champions as well. So if you want to have information hot off the press as well, please join up to be a community champion. And also a second plug to sign up for our residents newsletter, which I think David is putting in the chat at the moment. And again, we will be communicating out any changes, significant changes to guidance through our newsletter as well.
Thank you. We've just gone past 8 o'clock, so we'll have about another 10 minutes for people to submit questions, and we'll keep answering as many as we can before we end the event at past. The next question then is, in the event of a local lockdown, how can we ensure continuity of education for vulnerable children and their families? James.
So probably two parts to my answer to this. The first is that all of the government guidance so far has been really clear that even in a local lockdown, schools should remain open. And of course, we've got sort of live experience of this with local lockdowns in Greater Manchester, the North East, now Liverpool, and schools there have remained open throughout. So at the moment, one can be fairly confident that that would remain the case. The second part of the answer would be, well, as I said earlier, we can't pretend that we can predict what's around the corner. And so, yes, of course, it's possible that if the pandemic were to reach such a level of severity, that might be then reviewed. And I think what I'd say is that there's been an awful lot of learning from the first lockdown, and I think schools would be able to, together with kind of other partner agencies, be able to use that learning really well. Of course, in the first lockdown, schools never closed. They remained open for vulnerable children and the children of key workers. So it's possible that would be the case. But even if all vulnerable children were at home, then I would expect a partnership approach to ensure that kind of remote learning was still enabled as much as possible.
Thank you. Next question is one we've received in advance for Katie. What's the science behind children sometimes wearing masks in secondary schools, and why are they not needed in primary?
So the guidance is speaking about face coverings and not face masks. So face coverings are made of material and face masks are made to a kind of a specific standard. They're the blue ones that you might see people wearing. So the advice at the moment is that schools have the option, if they wish, to ask that people wear face coverings in corridors if they are unable to maintain social distancing in those spaces. The general thrust of the advice around face masks and coverings in school in general is that they are unlikely to have a significant impact on the spread of coronavirus in schools, but they have downsides, mostly relating to communication, particularly for little ones. I mean, but also they're uncomfortable to wear, and there's some real concerns about them being worn properly. And in fact, they can create a false sense of security, so people don't take the other measures that you need to take as well. So the advice is that schools have the option to do that in corridors, and my understanding is that that is more around building confidence for people to go to schools, than it is about spreading and reducing the risk of the spread of infection. And also to say that most, if not all, schools in the borough have done work to minimise the risk of people passing in corridors and bubbles passing in corridors. So the need for children to wear masks in schools really is minimal at the moment. But schools still have the discretion, for example, for visitors where it's really not possible to maintain social distancing.
Thank you. Next question is from someone who's asking about the rules in schools for social distancing for teachers and teaching assistants, and a concern that some teaching assistants might be going into different classes because of a lack of staff. Katie.
So the biggest risk around transmission of COVID in schools, so passing it from person to person, is adult to adult. That's where we see cases passing in national research, less so adult to child or child to child. So schools are working hard to try and increase, to try and reduce the transmission between staff members, and one of the most important things they can do is to try and maintain a social distance of 2 metres where at all possible. I know some schools have gone as far as having sort of pop-up staff rooms, so staff eat lunch on their own all over the school site. So really careful consideration there. And where staff members have to move between groups, there is risk assessments around that. Obviously, the less that happens, the better. But there's other sort of measures you can put in place to reduce the risk of transmission. And the only risk there would be if that TA has COVID and passes it from one into 2 groups. So it may be that 2 bubbles need to self-isolate instead of 1.
Thank you. And next question then is on self-isolation at home. So my daughter's been sent to self-isolate because she's been exposed to someone with COVID. I don't have an extra room in the house. Do we as a family need to self-isolate? She doesn't have any symptoms and it's been a week since she's seen that person.
Okay, so your daughter will need to carry on isolating for 14 days because it can take up to 14 days if she has caught COVID to show symptoms. So that's really important that she self-isolates. Everybody else in the house, assuming they're not contacts, they haven't been in touch with that case, they're contacts of contacts, they're a contact of contact, so you don't need to do anything differently. So mum, dad, any siblings, you can carry on going to school and going to work. Obviously you need to look after your daughter if she's little one, but apart from that, so your family's fine. Your daughter's a contact, so she needs to self-isolate. Let me just check the last bit. In terms of an extra room in the house and how to stay away from her, well, I guess it may be that she hasn't caught COVID at all. So in which case you're safe because you can't catch COVID from somebody who hasn't got COVID. The chances of you, if she has caught COVID, of catching it are highest when she has symptoms. So if she does have a temperature or a cough or a change or loss in her sense of smell, or then she needs a test. You need to start self-isolating too. Everyone in the house does, until you have a test result back. And at that point, you may want to really step up on that hygiene at home. So making sure you're washing your hands, you're cleaning regularly, and you're following the catch it, bin it, kill it advice as well. So not having an extra room at the moment is, I would say, is okay. And I would just sort of carry on, just watch out for any symptoms coming in your daughter and get tested if she gets them. And why not do your hand washing now as well? Get in practice.
Excellent, thank you. Next question, I think is for Katie, but James, you might want to add something as well. Do we have to get tested in order to go back to school? Can we just self-isolate for 14 days and then send children back to school? Katie.
I would advise that you get a test. So there's lots of reasons for that. If nothing else, then the chances are that if you have the main 3 COVID symptoms, you may not have COVID, in which case you can go back to school a lot earlier. If you do have COVID, then you really need to, it's good for you to know, right? But if you're not interested in knowing, then other people need to know, because you might have been in contact with other people and they need to self-isolate. So any of your contacts would need to self-isolate to prevent it spreading. So it's really important to get tested because it can prevent outbreaks. It can stop the transmission spreading in the community, and it helps protect vulnerable people. So if you're not that keen on finding out if you've got COVID, it would be great if you can find out to protect other people.
Thank you. Is there anything you want to add on that one, James, just in terms of? No? Excellent. Next question then is, are schools doing enough to ensure children receive adequate physical exercise to prevent further childhood obesity? James.
Yes, I think that's a really good question. I think my sense from what I'm hearing and seeing in schools is that I think schools are now getting back to some of the extracurricular kind of activities, and are now kind of being able to think about all of the aspects of the kind of school day, including physical exercise, in a way that perhaps they weren't in the first few weeks of term when they were so focused on just getting all of the logistics right to ensure that schools were safe places. And I think I've heard that certainly some schools are looking to resume swimming lessons after the half-term break, for example. So I think, yes, that's something that our schools pre-COVID were very focused on. I think still it will vary from school to school depending on how much space they have, including outdoor space, how easy that is for them. But my sense is that yes, schools are now kind of focusing on that and other wider issues, as well as now that the kind of new normal set in and the new rhythms of the school day are kind of settled.
Thank you. Next question is around children in early years and what support's available for parents who don't feel confident or comfortable sending their children early years back to school. Is the borough planning to find these parents, James?
So our approach and has all along with early years providers as well as schools is that we know that parents are going to feel anxious. We know that we are all living in an extraordinary context, and people's lack of confidence and anxieties are completely understandable. So we have said that we expect the response to those parents who don't feel comfortable or confident to talk that through, and I'm hearing that that's going on a lot in our special schools, in our primary schools and early years settings, and really pleased to see that I think our schools are able to build that confidence in parents as the kind of new arrangements settle down. The schools and early years providers can show to parents all of the steps that they've taken to ensure that schools are safe places. So yes, I think I would hope and expect that it's a sympathetic and supportive response that anxious parents are getting.
Thank you. Next question is about testing centres in the borough. So we've got a new COVID testing centre opened recently in Bow. How long will the testing centres here in the borough stay open? Katie?
I think it's difficult to say, actually. The testing centres are changing all the time. We're really pleased to have the 500th testing centre in the UK open in Tower Hamlets this week, and the staff in the testing centre said that it's actually also the nicest testing centre in the UK. It's in our Arts Pavilion in Mile End Park. The testing centres open. Well, they're opening generally to increase the amount of testing we have available. We have the capacity to increase testing where there's particularly high levels of cases. So we've seen enhanced testing in the north of England. They may change where they're no longer required, or where demand falls off for them, or where we have a new testing centre opening in a better location for residents as well. At the moment, I'm not aware of any plans to close any of the testing centres in Tower Hamlets. But the way that you find out what is open and what is closed is by going on the NHS 119 website or calling 119 to order a test, and then you will just be informed of the slots in the nearest testing centres to you.
Thank you, Katie. The next question is around why doesn't the Mayor of Tower Hamlets make it illegal for households to mix? So the Mayor's strongly advised that households, unless they have a really good reason, shouldn't mix, and that's because we've seen that the evidence is lots of the transmission rates in our borough are from households who are mixing. We can't make it illegal, unfortunately, as a council. The regulations have to be set by the government, and that gives them the powers to enforce that. So ours is just a strong advice to residents about what they can do to keep themselves safe and to reduce that risk of transmission in the borough. Katie, is there anything you wanted to add to that one?
No, I think you said that really well, Dan.
Thank you. Next question then for James is around lockdowns in schools. If there is another lockdown, a school doesn't help children with online learning, where can we make a complaint? So
the route for making a complaint about anything is to your governing body, and if it's a formal complaint, we'd recommend that people first speak to the head teacher and see if a complaint can be dealt with informally, and most complaints will be, to be honest. Head teachers will try and respond if they feel that that a complaint is valid, and deal with it informally. If you're still not satisfied, then it's the governing body that is there to kind of deal with formal complaints. Probably worth mentioning actually that the government's decided that it's going to set some kind of new standards for remote learning, and so schools are going to be sort of held to account. So it's not something that schools can choose to do or not do. All schools will be required to be able to deliver a remote learning offer going forward.
Thank you, James. Next question is about what schools do when there's a confirmed case. So Katie, I think you took us through it earlier, but perhaps just summarise the key messages again.
Yeah, so the main three things that schools need to do is firstly to identify who could have come into contact with that case. So they ask, when did the case develop symptoms? Who were they in touch with 48 hours before those symptoms started in the school? And then those people become close contacts. And up until, so it's 48 hours before the symptoms started until the child went home or self-isolated. So they become the close contacts. So the main thing is about informing those close contacts and asking them to self-isolate. the next bit is about cleaning and making sure that if there is any virus in the school, that's cleaned away. And then the third bit is about communication. So all the schools I've worked with have been really clear that they want to communicate really quickly with the school community, with staff and with families, so that they know exactly what's going on and how the school is managing the situation.
Thank you, Katie. Next question is about testing, and someone's asking why tests aren't carried out by professionals. I assume they mean health professionals. Parents are very anxious about carrying out a test on their children and hurting them, particularly young children. Katie.
Yes, as someone who's had the test done, it isn't nice at all, even as a grown-up. So I understand where that's coming from, and I know someone in my team felt that he'd broken his whole relationship with his daughter trying to get her to test. But the reason that we do say that parents can do it is that the research has shown that parents can do it effectively. However, if you are concerned, you can either you can get support when you go through the drive-in centre, so they can sort of help you with the technique. There's also support if you get a home testing kit as well. And in Tower Hamlets as well, we're developing a service where if you contact your GP practice, then they can put you in touch with some staff who can help you administer that test as well. But the bottom line is that in general, parents can do it, and it's been shown to be effective. And I think a large amount of bribery afterwards, I would have to say, with a healthy snack, might help.
Thank you, Katie. Next question for James. My school has our children in on a part-time basis from 1 o'clock in the afternoon to 4:30. Is this recommended?
So it's not something that we kind of recommend or seek to kind of dictate to schools how they are managing their school days. Really, we are here as a council to support our schools and our school leaders in putting the arrangements in that they think are best. It's a little difficult to comment without knowing kind of how old your child is, and what's kind of the thinking behind those arrangements. We do know that, I mean, the arrangements for the school day vary quite a lot school to school, and some look closer to a kind of normal school day, and some look really quite different. So again, as sort of with other comments, really, if you've got concerns about that, I'd urge you to take it up directly with the head teacher and expect them to be able to give you a specific response.
Thank you. Next question then is on isolating, and it says, wouldn't it be better for the whole family to self-isolate? I assume that means if someone in the household's been in contact, should the whole family not just self-isolate? Katie.
So yeah, it would depend on the scenario. So if it is the one you mentioned, Danny, so if a child has been identified as a close contact, but the rest of the family isn't a close contact, then the advice is that the rest of the family don't need to self-isolate. And I think we talked about that in an earlier question. There's some real impacts on families of self-isolating and not going to work, and the loss of income that we're very concerned about. And there's quite a bit of advice on the council website if families are in that situation. There was a question a bit earlier about getting tested, and when I was answering, I was thinking through a scenario where somebody has symptoms and doesn't want to get tested. And my answer kind of related to that scenario about if you have symptoms and you don't want to get tested. But if this is a case where there is somebody who is a close contact and they've been advised to self-isolate for 14 days, they shouldn't get tested unless they develop symptoms. So if you are a close contact, you need to stay at home for 14 days. And that's because it can take up to 14 days for COVID to kind of brew inside you to the point that you start developing symptoms and the point that you can be infectious. And also it can take the same amount of time, up to 14 days, to actually test positive as well. So if you are a close contact and you decide to get tested really early on because you want to get back to school, then you could be really falsely reassured by a negative test when actually you do have caught COVID, and up to 14 days later you can go and get symptoms and test positive a bit later. So we're really, really clear that if you are told that you are a close contact and you need to self-isolate for 14 days, it's really important that you keep going for that 14 days.
Thank you, Katie. That's all the questions that we've got time for this evening. Big thank you to Katie and James for coming along and answering all those questions with us, and for all of you at home coming along and tuning in. I hope you found it useful. You can find further information on the Council's website, www.towerhamlets.gov.uk, or on the NHS website as well. There is a short survey on the Q&A box, so if you could give us your feedback on tonight's event, we'd really appreciate that. And all those questions that we haven't been able to answer, we'll try to answer in a frequently asked questions document that we'll send around to everybody in the next few days who've been on this event this evening. Thank you very much. Good evening.